Good evening, students. Once again, welcome back to our channel, Ach'z. So today in this section, I thought of discussing about the complete preparation guide or the topic prediction for your OET exams. If you are planning to give your OET exam by 28th of June 2025, so this video is for you. So those who are planning for the 14th of June, we already updated the video, the ultimate guide. So I will provide the link in the description. You can just have a look. Okay, now we are going to discuss about this 28th of June 2025. So prior to moving further, and nowadays many students, they are saying that they find difficulty to construct the sentences, or they don't know how to react in different scenarios. That is only because of lack of practice. So if you are not under an institute, even if you are under an institute, means it's for a time duration only you are spending the time over there. You need to spare more time for your self preparation. You should give more attention towards your grammar, your vocabulary, your sentence construction and all. So that's why I like to suggest a trustful AI application, okay, which you can download from your Play Store. So whenever you feel that you need to polish or you need to be proficient in English language, at that time you can spare your time with your AI friend. So that is Sparky. So you can just have a look at the features of Sparky, how it will help you in your OET journey. Then you can come back.
Here comes the Sparky, your English speaking AI friend. If you're worried to talk in front of others and worried about your mistakes, so here Sparky for you. He can understand you better even with the broken English. And Sparky will gently correct your mistakes. You can talk about whatever matter you have in the life. That may be about real life scenarios, even about your job, your daytime, your daily routine, your leisure time, and what else. Apparently, you get an opportunity to convert the English language into your own mother tongue, your local languages, even regional languages for your better understanding. And Sparky will give you instant feedback about each and every mistake, that may be the vocabulary or grammatical mistakes, and you will get an opportunity to save the new words which you studied to your personal dictionary, and you can revisit the dictionary at whenever you want. And there are a lot other settings to change the accent into Indian English, British English, American English, and all. And you will get an instant feedback about your grammatical score and about your milestones. And not only this, you can just make your time more fun by playing some games, by learning new vocabulary, the grammar, and even spelling. Revisit the folder at any time you want to see the words which you study and for your daily practice. And even you can read the newspaper articles and discuss about the news to your AI friend. We have a lot of feedbacks to share from those who consider Sparky as their real life friend. So here you can see some of them, those who find this application helpful to learn their English better and to talk confidently. You can see the difference from the first week itself. So what you're waiting for, just download the application for effective learning experience.
So that's it. I hope it will help you out in your OET journey. So download Sparky app and practice from today. So now coming back to the point, we are going to discuss about the 28th of June 2025. How will be the test? What all are the predicted topic? Okay, so we will move in detail. First about the writing section. I don't want to say the format again and again in each video. So I will directly discuss about the topic. So for this particular test date, you need to concentrate on discharge letter and also reference letter. So these are the two category you need to concentrate more for this particular test date. Now about the topic you should concentrate. I like to include 10 topics only. Related to this, you need the question and the sample answer in detail, means try to comment about that. We will publish that in our Facebook page. So try to watch on our Facebook page. The link is there in the description. You will get the materials from there. On the daily basis, we are just updating the role play cards and the writing topic, reading topic, everything we are updating there only. So you will get sample from there. Okay. Now coming back, the first topic is a post-operative care like the hip or knee replacement. Second topic, diabetic management, type 1 and type 2. Third topic, chronic wound care like the pressure ulcer or about this leg ulcer. Then the fourth one, palliative care for cancer patients. Then the fifth one, mental health issues, especially anxiety, depression related to postpartum or in the elderly patient. Then the sixth one related to this asthma exacerbation and to the patient education. Seventh one, rehabilitation. That may be the stroke or any type of neurological conditions. So then eighth one, pediatric care, especially the infections like the fever or like any convulsion episodes, seizure episodes and all. Then the next one related to cardiac conditions, heart failure or related to MI recovery, myocardial infarction recovery and all. And to the last one, geriatric care or related to the fall prevention, the devices related to that and all. So these are the 10 different topics or the area you need to concentrate for your letter writing. So I hope it's clear. So as I mentioned before, you need to concentrate more towards the referral letter and to the discharge letter this time. And for this letter writing, you need to group your data properly. Avoid irrelevant information. There are a lot of information in your question paper. You don't want to include each and everything in your letter. Okay, so try to group the data properly. Be concise about your writing. Try to follow this formal format. You know that how to open up the letter, how to end up the letter, what about this body paragraph, how what about this salutation, everything need to be proper and use proper linking words, and your vocabulary should be formal enough. Okay, so try to concentrate on the basic criteria or the format of OET writing. Then coming towards the second module, reading, for that we will discuss about the part A section first. I like to give 10 to 15 topics under part A because many students find difficulty in part A. That's why we are releasing more materials in our Facebook page related to this part A. Okay, so if you find difficulty in part A and want to know about the updated topics, try to just visit our Facebook page. Okay, you will get the daily practicing materials over there. So here you know that you will get 4 short tests, that may be any type of drug chart or the patient leaflet or the referral notes and all they will give. Now coming towards the topics you need to concentrate. The first one is type 2 DM. So in the parts, that means in the different text, they can give about the symptoms or diagnostic criteria or about the long-term management and even the hypoglycemia risk. The second topic is COPD, chronic obstructive pulmonary disease. The sample is there in our FB. So they can give about this inhaler techniques, oxygen therapy or this smoking cessation advice and all. The third topic is congestive heart failure. They can give about this fluid restriction, diuretic use, the daily weight monitoring and all in each and every text. Then the fourth one, UTI in elderly, they can ask specifically. In that they can ask for this atypical presentation, confusion, antibiotic guidelines. Then the fifth one, pressure ulcer. Then in the text, you can expect prevention protocols, Braden scale, repositioning schedules and all. Then the sixth one, stroke, ischemic or hemorrhagic stroke they can ask for. Fast test they can give or rehab plan or anticoagulant therapy in the subtest. Then the seventh one, post-operative wound care. They can give the subtest like the signs of infection, dressing types or the suture removal timelines. Then the eighth one, pneumonia, antibiotic regimen, oxygen saturation monitoring, elderly complication and all you can expect in the test. So the ninth one about asthma, in the text they can give this peak flow meter use or the steroid tapering or trigger management and all. Then the 10th topic, dementia and delirium. So they can give about the safety strategies, orientation cues, or non-pharma approaches and all. 11th one about DVT, deep vein thrombosis, risk factors, the compression stockings, or about the anticoagulant use and all they can explain in each and every text. Then the 12th one, common topic, hypertension. They can ask about this BP monitoring, lifestyle changes, medication side effects, and all. 13, fracture. They can ask about this hip bone fracture or about the femur bone or the neck fracture and all. So, surgical consent, mobility aids, or about the fall prevention and all they can explain in each and every text. So 14th one, they can ask about this anaphylaxis or about this allergic reactions, explain about this emergency signs, observation protocols, and to the last topic about CKD, chronic kidney disease. So they can give for this dialysis information, fluid monitoring, fluid balance monitoring, and the diet restriction and all. So that's about the 15 different topic I like you to concentrate for the day. So try to focus on this heading, keywords, and even the unit and take care about the synonyms. So you need to give more time to concentrate or just prepare some synonym bank. Okay, prepare or collect some synonyms, then it will be helpful in your real exam. Now we will move further with part B and C or about the C1 and C2 extract, what you can expect. So the first topic is infection control guidelines. Second one, documentation protocols. Third one, manual handling procedures. Fourth one, medication safety and administration. Fifth one, nursing scope of practice. Sixth one, shift handover communication. Seventh one, new technology in nursing like this electronic records and all. Then eighth one, patient-centered care policies. Ninth one, pain management protocols. And the last one, vaccination schedule and the updates. So that's about the topics for C1 and C2 extracts. So the time management is very important. When you practice in your home setup itself, take care about the time. Try to put on the alarm. Then you will be conscious about the time. You can just complete within the time span and concentrate on the synonym presentation as I mentioned before. They can paraphrase the content using the synonyms and also try to concentrate on that and always try to skim for some keywords. And for this C1 and C2 you need to give more attention towards this inference type of question or the author's opinion based question and all. So that's the area you need to focus towards. Now we will move towards the listening subtest. As you know, the part A you will get some consultation extract. Part B will be like some workplace related extract. And the last part that will be like an presentation or interview. So this time you should concentrate on the topic like the first one, wound care consultation. Second one, asthma education. Third one, mental health nursing scenario. Fourth one, end of life communication. Fifth one, medication administration errors. Sixth one, nutritional assessment. Seventh one, patient fall risk management. Eighth one, pre-operative preparation. Ninth one, about this COVID or the post-COVID care policies. Nowadays, the COVID cases are increasing, so they can include this relevant topic. 10th one, professional development in nursing. So that's about the 10 different area of topic you need to concentrate for listening module. So try to practice with real OET audios and try to take some notes if you are practicing this part A section. And in part C section means you need to concentrate on the tone and implication. And it's always better to predict whenever you get some time to read out the question and all. Try to predict about the type of audio or what they can include in the audio or what can be the answer. So like that, try to make some prediction. And along with that, when you practice, try to go through different type of accent, the British accent or the North American accent. They can use different accent. So try to concentrate on that too. So that's about the listening section. Now we will discuss about the last module, speaking. You know that you will get 2 role play cards, 5 minutes you need to spare for each, 2 different scenarios. That may be the conversation between the nurse and patient or with the colleague or with the caregiver. So this time I like to give some topics for your preparation. So if you need the sample means, try to mention that below. So the first topic is explaining insulin administration to a diabetic patient. Second one, advising elderly patient after a fall. Third one, educating a patient about pressure sore prevention. Fourth one, supporting a parent of a febrile child. Then fifth one, post-operative care explanation to a caregiver. That may be the care home and all setting. Then sixth one, clarifying the wound dressing techniques. Seventh one, handling aggressive or anxious patient. Eighth one, giving lifestyle advice for hypertension. Ninth one, discussing palliative options with a relative. And the last one, discharge instruction following the surgery. So that's about the different topics. So as I mentioned, always try to construct some empathetical phrase. And we already released the video for different scenarios. What are the common phrases you can use, and also try to watch that. And the listening vocabulary, everything we released the video. So try to go through the playlist and you will get more tips and tricks from there. And whenever you are practicing, try to prepare with some open-ended question. Okay, your conversation should always be with open-ended question. You should give an opportunity for the opponent to ask some question or ask for the clarification and all. And whenever you are replying or you are answering for the queries, you need to maintain the empathy. Your tone, your style, everything should be in empathetical nature. Okay, and try to avoid the tough medical terminology. Rather than that, if you are talking with a patient means, you should keep in your mind they are unaware about this medical terminology and all. So try to make everything simple and in a concise manner. So that's it about the preparation guide or the topic prediction for 28th of June 2025. So all the very best for your preparation. And do subscribe to get more updates related to this OET. And soon after the exam, we will come out with the question paper discussion in the global basis. It's not for any particular country. So all the available question paper we will discuss during our review section. So you can also share your experience during the discussion section. Comment box is for that. You can just discuss with your with the other teammates or those who already attend the exam. So you can just make a discussion, what all things you remember, share the answers and all. Then it will be a good time for others. And to those who are planning to write OET exams in the upcoming months, try to watch on this preparation guide and the review section to know about the trend. So as I mentioned before, the updated materials or the new topics we are releasing in the Facebook page. So from there means you can read or according to your time, you can just read or you can take a screenshot or you can just download the material and practice. So that will be more comfortable to you. And other than that, previously we were conducting some mock test in the YouTube platform itself. You can just check out that in the playlist. So if you want me to do like that, that means the complete reading mock test and all I want to do according to the things which asked in the real exam, you can just comment over that. Definitely we will come out with the video like that. And other than that, you need any tips and tricks means, you can also comment about that. Definitely we will come out with more videos or the sections in relation to that. So that's it. All the very best again, and God bless you all. Do prepare and do your exams well. Thank you.